built basements.
Welcome back, everyone. Boy, you look tired.
You know, the funny thing is, I don't really feel tired.
I'm looking at your eyes, and I think they look tired.
You know, I get that a lot. I think maybe I should do something about it.
If this is a conversation that you've had recently, you may want to pay attention to the next story.
Take a look. Sharon Leonard is a vibrant, lively woman, but she tells me her eyes used to tell a different story.
I look tired.
And you look
all
tired
the time.
all the time.
All the time.
And who wants that?
And I wasn't tired.
That's why she came to see Dr. Sarit Patel. He's an oculoplastic surgeon with Starling Physicians in New Britain.
I've trained as an ophthalmologist, did a residency in ophthalmology, and then did additional training, additional 2-year fellowship in what's called oculoplastic surgery, which is plastic and reconstructive surgery around the eyes. It's very specialized. It's very specialized. There's about 25 to 30 fellowships per year in the country. So there's about 500 of us that are trained in this, specifically trained in this, and it carries the whole gamut of things from medical problems, eye tumors, to growths behind the eye, broken bones, fractures, tearing, and then also droopy eyelids. I'd say there's probably 2 big classes of people that come in, or two types of patients that I have. One is that have droopy eyelids, and it's really a medical problem. You know, they're having trouble reading, they're having trouble driving because the eyelids are getting in the way of their vision, and it's like there's a curtain come down and they can't see. And so it's a safety issue and a health issue. And that's probably, you know, half of the patients that I'll see with droopy eyelids. The other half are people that, you know, are bothered by the either skin or puffiness around the eyes. And the main thing that I hear is that they don't look how they feel. That they feel rested, they feel energetic, and people are always telling them they look tired.
Since this was the case with Sharon, she decided to have 2 procedures done on her otherwise healthy eyes. The first on her upper eyelids.
So this was Sharon about 8 years ago when I first saw her. She had some extra skin and the eyelids were a little bit droopy, and by doing, I think, a fairly subtle procedure and a subtle change, a change of a couple of millimeters or so, it really opened up her eyes.
The procedure Dr. Patel performed?
So it's called a blepharoplasty, and that can be done in the top eyelid or the bottom eyelid. And there's different variations of it, including trimming some of the skin back, or taking some of the fatty tissue around the eye and trimming it back, or moving it. And it really, the specifics of the surgery have to be tailored to the particulars of the patient and what the needs are. Okay. It's not that there's one surgery that works for everybody.
Right. Here are some other patients that have had the procedure done.
The important part is knowing how much to cut out.
Right.
There's the old saying, measure twice, cut once, right? And so it's measuring the landmarks that are there and knowing how much is safe to take out. The risk in taking too much out is that it's going to pull the eyelid too tight. It's not going to close. It can lead to dryness of the eyes and all other kinds of problems. To a certain extent, that's why being an ophthalmologist, I think, gives me allows me to have as a priority the health of the eyes.
This past March, Sharon had her second procedure done, this time to address the skin under her eyes.
We talked about doing something with the bottom because I had a lot of puffiness.
That tired look was making a comeback, and Sharon wanted to nip it in the bud.
The bags under here were really becoming a main point of focus, both for her and the people around her, the points of conversation. And those are because of some pockets of fat around the eye that were bulging forward. Right. And so by trimming them back in a relatively subtle way, it does open up the eyelid. And again, somebody looking at this photo may not think that there's anything there, right, but that's the point. And in my opinion, a good result is a subtle result, that somebody looking at you afterwards is not going to know that you had surgery done, but is maybe going to tell you, boy, you look like you're rested. Were you on vacation? This procedure was about an hour to an hour and a half. Yeah. And again, in an office.
Yes, for Sharon, this was an outpatient procedure.
I had no idea that it was something that could be done here in the office.
Right. And in an outpatient procedure,
Sharon couldn't be happier with the results.
I had noticeable swelling beforehand, and that is gone. So I'm grateful for that. I would not let anybody but Dr. Patel do the procedure.
What has it done for your confidence and your, just your
self-esteem, I think, a little bit. You feel like people aren't saying, oh, you look tired, oh, what's wrong? Is something wrong? Did you have a bad night? They're not saying that anymore.
Good. That's awesome.
It is awesome.
That's terrific.
He's awesome.
All right, to learn more about treatments for conditions affecting the eyes and the area around the eyes, head to starlingphysicians.com/oculoplastic-surgery. We're also going to have the link on our website, betterct.com.